Today we will deal with titled The Organ Dealer. The illegal organ trade is a dark and disturbing reality, with thousands of impoverished individuals being exploited worldwide. One of the most infamous figures in this illicit industry is Amit Kumar, a self-trained doctor who orchestrated a larger-scale illegal kidney transplant racket in India. His story, detailed in the Discover magazine article, The Organ Dealer, sheds light on the gruesome underground market of human organs, the ethical dilemmas surrounding organ transplants, and the failures of law enforcement in tackling this crisis. The rise of Amit Kumar. Amit Kumar, originally known as Santosh Rot, had no formal medical training yet managed to establish himself as a kidney transplant surgeon. He operated under multiple aliases, building a network of brokers, medical staff, and unsuspecting donors, many of whom were coerced into selling their kidneys. His operations primarily targeted poor laborers, promising them financial relief, but often underpaying them or outright deceiving them about the nature of the procedure. Modus operandi, a complex web of deception. Kumar's illegal operations stretched across India, Nepal, and even as far as Canada. His team lured vulnerable individuals under false pretenses, often telling them they were undergoing routine medical tests, only to wake up in a hospital bed missing a kidney. On the other hand, desperate wealthy patients from around the world sought his services to bypass long waiting lists for legal transplants. The illegal transplants were performed in makeshift hospitals, often in unsanitary conditions, increasing the risks of infection and complications. The market for illegal organs. The demand for organs far exceeds the legal supply, fueling a black market where criminals like Amit Kumar thrive. According to estimates, thousands of people die each year waiting for organ transplants, while unscrupulous operators exploit the vulnerable. The kidney trade is particularly lucrative because a person can survive with one kidney, making it easier to coerce individuals into selling theirs. Law enforcement and legal loopholes. Despite the existence of strict laws against organ trafficking, enforcement remains weak. Kumar's operations continued for years due to corruption, lack of oversight, and complicity within certain segments of the medical community. Although he was arrested multiple times, he frequently managed to escape justice by bribing officials or exploiting legal loopholes. His 2008 arrest in Nepal was a turning point, but the scale of damage he had already inflicted remains immeasurable. Ethical and humanitarian concerns. The case of Amit Kumar raises profound ethical questions about the organ trade. While some argue that allowing a regulated organ market could reduce exploitation, others warn that it would only legalize the commodification of human bodies. Furthermore, the lack of a global consensus on organ donation policies exacerbates the issue, leaving room for criminals to exploit disparities between different countries' regulations. The way forward. To combat illegal organ trade, stronger regulations, stricter enforcement, and public awareness campaigns are necessary. Governments must establish comprehensive donor systems to bridge the gap between supply and demand. Additionally, tackling poverty and improving healthcare infrastructure can reduce the financial desperation that pushes people toward selling their organs. Finalizing today's issue, organ dealing. Amit Kumar's case serves as a chilling reminder of the vulnerabilities in global healthcare systems. While he was eventually apprehended, the illegal organ trade persists. The need for ethical solutions to the organ shortage crisis remains urgent, requiring a combined effort from governments, medical institutions, and human rights organizations.